Hi, everyone. My name is Successful. This is Breaking the Stigma. I'm here with my co-host, O'Neill.
How y'all doing? My name is O'Neill. This is Culture Therapy.
All right, great. So we have a special topic today that's pretty much surrounding what's been going on around the world. We're going to be talking about racial trauma. We have two magnificent guests that we're so excited to have. They're definitely going to enlighten us today. So we're going to let them introduce themselves, say a little bit about who they are and what they do. So we'll start with you, Eka.
Hi, my name is Eka. I am an associate family therapist. I'm registered with California with the Board of Behavioral Sciences. I've worked with former probation youth, youth that were in foster care, family and their families, providing therapy, providing case management, housing resources, and so on. Currently, that's my population of choice. And I'm working on my license, so waiting to take my clinical exam and then do a private practice.
That sounds awesome. Okay, Jason.
Hi, my name is Jason Thompson. I've actually been in mental health since about 2008. Started off in an acute settings, inpatients, where all the stigma starts. Developed and trained myself there and got exposed to ECT. The older style electroshock therapy, if you will. And starting in 2012, actually got into TMS, or transcranial magnetic stimulation, as an alternative therapy to treat different neuroses, including depression, anxiety, and OCD.
That is so awesome. We are definitely going to have you back to talk more about that, because a lot of people don't know exactly what that is, and that's very, very important, especially today, like you said, with treating depression and anxiety. So thank you so much for being on the show today.
Thank you for having me.
Okay, so let's just jump right into the first question. Eka, I'm going to ask you, what is racial trauma?
Racial trauma can be an experience of like oppression. It can be experienced from different slurs maybe that have been said to you directly, or things that you're seeing in media, and they're affecting you in ways that prevent you from feeling that you can be effective in society, your worth, or being able to, press forward and do the things that you would desire, because you feel that you have this barrier based on however you've been conditioned to believe. And so right now we're seeing a lot of racial traumas, or we are all experiencing racial trauma in ways because of the current day society. With the pandemic, for one, there was a certain population of or ethnicity group that was targeted based on where the COVID-19 began. And then once it came to the U.S., how the numbers were very off as to who was dying most, who was being diagnosed the most. And it was, again, targeting a certain ethnic group. So that was traumatic, because then those people who are in that ethnic group or in those ethnic groups were feeling targeted. And if they're already a minority group, which the targeted group at one point was the Chinese, and then it became African Americans. And as African Americans already in the U.S., we are already a targeted group and feel trauma from years of oppression and slavery. So then you have this pandemic, and are experiencing more oppression because of a virus that clearly there's no cure. We don't really know where it's stemming from. There's so many unanswered questions. So that's a traumatic experience, because you don't know if you or your loved one may have it. Mm-hmm. So trauma comes and looks different, but in current day society, it's looking like oppression in the form of medical disease.
Well, actually, I do have a question for both of you. Racial trauma, of course, being connected towards ethnicity and systematic oppression, and this goes beyond just the Black community, of course. Like you stated, the Chinese at one point, Arabs, Native Americans, and things like that. But when you're treating people for something like racial trauma, because it's more of a communal thing. It's how do you treat something that's systemically goes beyond that person's just their trauma, because it's a greater thing. It's a whole system that's brought down. Yeah, I wouldn't say brought down, but oppressed a whole ethnic group. This is not just treating somebody's depression in their own personal life. You're kind of treating them and the community. So what kind of do you guys do, and not necessarily with just the Black community, but any community in general? How do you treat and diagnose, racial trauma that extends further than that person, but communal trauma that affects everyone in that community?
I think it's important to be culturally competent about who you're treating. So, what may look like one diagnosis in one culture may be very different in another. There's some things that are very black and white and more gray area, of course, with them and need to be treated accordingly. But then there are other things that, could really just be cultural dynamics, so understanding their backgrounds, understanding why they have those beliefs, where they stem from, and then, as an individual, asking them, how do you feel about your belief? Because it could be, it could be a ritual, it could be something, familial origin, but you might have your own individual beliefs. So understanding them culturally first, I think, is most important, and then moving on into individual things to kind of come up with a good diagnosis to really treat them and provide them with the best services possible as an individual.
Mm-hmm.
I think she's actually got it very well. Is that you have to understand the individual that you're dealing with and speaking with and trying to help, and peeling it down as the different layers of an onion, if you will. Understanding what it is that they've gone through, what kind of support systems they currently have, and dismantling the common negative connotations that are enabling or not creating the ease of access for mental health help.
Mm-hmm. Mm-hmm.
Understanding those different communities, whether they're just ethnic based, or maybe they're veterans, or maybe it's a combination of multiple things. Understanding that demographic is going to be extremely important to provide beneficial help.
Yeah, no, actually, that's interesting. Like, and we can maybe kind of go beyond little racial trauma, but just different ethnic backgrounds, different religious backgrounds. When you guys are treating different forms of people, what's kind of in your guys' mindset when you do? Okay, this person, this is a lower income, or this is a older Hispanic person, things like that. Do you kind of change the way you treat people? Obviously, it's not a monolith. You have to be able to kind of adapt and sway and move with the treatment process of your client or your patient, things like that. What's in your mindset? What do you guys kind of do in your process to kind of, treat uniquely the person that you're treating, essentially?
Or let me just say this, Brian, to add to it, what would make it difficult? Because like you're saying, those are different factors that they have to also think about, but what makes it difficult to treat?
Mm-hmm.
I think when you have like a client who is very in tune with their religion, it may be more difficult because for whatever reason they were led to therapy or counseling. It might not even be their choice, but maybe something that's just been highly recommended and pushed, or if they've been in some type of legal trouble and they have to do it for a certain reason. And even when they come, if they have to, again, like Jason was saying, like unpacking those layers, so if they're really heavily embedded in your religion, that could be something that's going to be very, hard for them to like look past, So
it can also be used as a tool, I think. When somebody is deeply rooted in their religion, they have the ability to have that higher power that you can use. So having the education that you're talking about the individuals is definitely going to be important.
Yeah.
Cool.
Well, how does it also affect people that are not of color?
Yeah.
I think at the end of the day, a lot of how it impacts people without color is ignorance. I'm in a family now that is mixed. My children are Hispanic, but I also have a stepchild who is African American, and he got pulled over a couple of months ago, and it was a very scary situation, and it was never real to me about the conversations that have to be had. I would never have to have it with my Hispanic children, and it brought forth a whole new light bulb, a ding moment that holy shit, that this is actually here.
Right.
So a lot of it was not that I didn't want to see it, it's just that I never had been abreast to it. So I think a lot of it is ignorance.
Question then for you, Jason. What do you, knowing and acknowledging that and understanding that, what's the conversation that's had? What do you kind of tell your family members that aren't, of course, aren't white or lighter skin, that are susceptible to these kind of, discriminatory policies that can affect them? What conversation do you kind of have?
I mean, understanding that people are people first, regardless of what's going on. We all have basic wants, desires, needs, and we have to be able to fulfill those. But to put it in that situation, it takes it completely out of context. The conversation with Mason was completely different. Because it was new to me, it was, what resources do I have? Who can I talk to? I came to you and I was like, hey, what does this even really look like?
Right.
Just because it was new to me, I wanted to make sure that I was educated, that I was giving not just profound fatherly figure advice, but something that was going to help him now and moving forward.
Mm-hmm.
To completely educate him about the situation, what it's going to look like, how it could impact him not only now but in the future, and his lineage. When he decides to have a family.
Right. That's excellent. Okay, I do have a question for you as well. In terms of, and kind of going back to what Successful was talking about with racial trauma, and that, honestly, this is open to everybody. That when I look at racial trauma and things that happen within these communities, with slavery and then Jim Crow, the black codes, and then police brutality, things like that. I always seen racial trauma not just a one-way street. I mean, it did affect, it does, and it still does affect the black community, the brown community, but it affects the white community as well. I want to be able to, when we have these discussions, when we have these conversations, that it's not just, we need not just the people who are affected traumatically by those events, but those who who allowed that system to be in place, and that would be non-people of color or in white people in the country, that they were still affected by it as well. I think that when we talk about racial trauma and how to treat it, I think that we also need to treat not just the symptoms that happen within the black community, but also how it also affected the white community as well, and the mindset that they were put in place. Even though, of course, white people today, the majority of people are not racist. Let's just be honest. The majority of people aren't racist. However, there's systematic institutions and policies that are still put in place. So we get kind of lulled in this complacency, like it doesn't really happen. So how do we diagnose that problem? That it's not just a problem within the black community, but I would also say a problem within the white community as well with racial trauma.
I mean, it all can be a diagnosis of PTSD, of paranoia, social anxiety,
Mm-hmm.
things like that, because it's all included in your community. So you're going out into the community, all those things, all those different feelings can come up, and it's not only as the victim, but as the oppressor as well, because then you have those worries of, are things going to come back to haunt me? Are there going to be people out to target me because they think that I am, like you said, there may be people who aren't racist, but if there's different groups that are targeting one group and looking at one group, you're walking around kind of like, I'm not racist, but now it's kind of flipped because you still look like the majority of the oppressor is, so a white person.
Right. Understand that. Got you. 1 second. Okay, so my next question for you guys is, what's, and this is tough because when we talk about racial trauma, when we talk about the treatments that you can do, what kind of coping mechanisms? And I kind of have a couple examples in my own head, but I kind of want to hear what you guys have to say about this. What could we do as a coping mechanism to help with dealing with racial trauma?
You always have to understand what the enemy is, if you will. So the symptoms that we're dealing with, the diagnoses that we're coming up with, being educated on what can combat it, whether it's medication, whether it's talk therapy, whether it's alternatives like TMS, ECT, CBT, DBT, EMDR. There's a lot of different ways that you can attack the so-called enemy. But you always have to be educated. You have to outthink that enemy, and you have to be able to move and anticipate what's going to happen. So that if an individual reacts a certain way, you can already understand why they may react that way. and use it to the advantage so that it becomes more therapeutic for that individual.
Mm-hmm. Mm-hmm.
Yeah, and to piggyback off of that, also, like Jason was saying, understanding what you're feeling, so that is it that you're feeling aggressive? Is it that you're feeling sad? What are you feeling when you're dealing with this, and then addressing that appropriately, because it could go, in a negative way, or it can be positive as well. And then understanding, like we said, the enemy, who and what you're up against. You can't change the minds of others. So is that causing you more friction and causing you more your mental, or them?
Right.
So who are you trying to change, yourself or them?
I do want to go back to the racial trauma and how it affects different cultures. How do you think that it affected? Any of you can answer, both of you, affected the onlookers who witnessed George Floyd being killed by the police officer?
I think it was just a moment of being human and having empathy before it even became a separation of, your ethnic background. Seeing anybody like that in that position, I think if I was walking down the street, I would feel some type of way regardless. And it really probably would be even just towards the police, just in general, like, and regardless of what color they were too, I would still feel empathic for a human being treated like that. But I think because how it was played out, and the roles, the ethnic backgrounds of both George Floyd and the police officer, it took on a different feeling.
I think honestly, and I'll call it how I feel it. I think it's disgusting. If I was walking down the street and I saw it the way I am, and understanding that people are people irregardless, and maybe that's because of my experience in the military. Maybe it's because I've worked in the acute setting, and people of many illnesses are still people irregardless. It just can't happen. And so I went through an array of feelings. It was disbelief, it was frustration, it was anger, it was how do I support the all the wrong things that were done? How do you change that? But it all came to me was just disgust that I can't even believe that people were doing that to people. So.
Mm-hmm. No, yeah, it's whenever I saw the first, the video with George Floyd, and this is kind of what I had to tell, and people needed to really understand, is that it was like Jason said, disgusting. It's a disgusting act that happened, negligence and cruelty. Unfortunately, a lot of Americans don't realize is that the black community were angry but not shocked. There's plenty of videos of this happening. I mean, there's over 264 police officer deaths of unarmed assailants, if you will, suspects, in the past year. I mean, there's plenty of videos and cases just like this, just like with George Floyd. I mean, if you look at Sandra Bland, Ahmaud Arbery, obviously that didn't have the police involved, but Tamir Rice, Eric Garner, Michael Brown. I mean, the list goes on. I think that it's tough. It's tough seeing it, and in your immediate response is anger, but seeing it in person, in the onlookers, like Successful was saying, that almost were stunned and shocked. And I think that's why we're seeing such a reaction now, is because we're those who didn't really know about police brutality, or maybe didn't think anything of it, finally saw it in its raw form. And I would even say that the onlookers there, those who were not people of color, were probably shocked. We're probably like, oh, like this is what they were talking. This is what Black Lives Matter was talking about. This is what Kaepernick was kneeling for. Like, they actually physically saw it. I mean, that's why the NFL now is making statements saying that they were wrong. And so, as onlookers, when you see this, understand, like, and what Jason and Eka have kept repeating and had to reiterate, is that it's the education. It's knowing what to do in those situations. It's knowing and understanding the historical implications of police brutality and racial disparities. And then from there, what's next? What's the conversation afterwards? And that's kind of what we're doing today.
I just think oh, I'm sorry. Go ahead, Jason.
No, I was just going to say, what do you think it would have looked like if somebody had intervened?
That's what I was going to ask too. But somebody,
unfortunately,
too.
Unfortunately, it would have been worse.
Yeah.
You think so?
Yes. It's and you can't. I hate. We should never generalize. You should never generalize anyone, whether it be police, white, black, Asian, things like that. However, in that situation, that was a dangerous situation with dangerous men with weapons and power. You know, it would the ones that should be intervening are the other police officers. That's their job. That's their duty.
But do you think if a white male was to have intervened physically,
no,
that something different could have happened?
I don't think anything differently would have happened. I think that you would have had another victim, like O'Neill was talking about.
Yeah.
You know, I can't even imagine. I just was curious at what everyone thought was as far as would it have changed the outcome.
So, Eka, what do you think? Do you think it would be the same outcome?
I think the outcome would have been the same, but the individual who would have intervened, whether it be a white male or female, just would have been taken to the side and a discussion may have been happening. Maybe they would have been arrested, but I don't think that would have stopped the main individual who was there because he was doing it alone. You know, it wasn't like it was him and another person. There were just 3 other people around pretty much to prevent anyone from intervening. And like, you know, O'Neill was saying, those people were powerful. They had guns, they had batons. So if anyone would have intervened, again, like Jason said too, there would have been another victim in some way. But I don't think the outcome for George Floyd, unfortunately, would have been any different.
Yeah, I definitely agree. The officer who was the one who killed him definitely seemed like he was on a mission. So I could see him definitely, you know, stopping the person from intervening as well. So I know that Jason, your father, and Eka, your mother. How do you explain these racial disparities with your children? Are you having these conversations?
My daughter's 3, so I haven't had the conversation per se, but just being cognizant of what she watches. She watched something with the police, and then she pretended to like arrest my husband or put him in a chokehold, and it was kind of disturbing for us because I have no idea where she's seen that, you know, and it was cartoons that she was watching. They talk about police officers, cops, and robbers, so that was like the first thing that really sparked something to say that not necessarily can have a conversation with her because she's free, but just being more aware of what she's watching. And if it is something with police officers, I do want to see what are the images that are depicted, and that for her to, you know, to do that. And it could have came from anywhere, but it did strike something in us, and it was kind of disturbing.
I've got older children, so for me, it's intertwined with how they react, and I think everyone is going to naturally have a feeling or an emotion, and you can't ever tell them that emotion or that feeling is wrong. It's how they act on those emotions and those feelings. So the conversation is to me always a why. You know, why do you feel that way? How does it make you feel? What does it make you want to do? So that I can get to the understanding of what it is that we're really dealing with in that surface knee-jerk response emotion that they're having. And that could be on anything.
Right, definitely. Well, guys, this has been a great interview, and I think we should definitely continue this conversation because there's so much more to it. I know we only had a short period of time, but we didn't speak about the depression, the anxiety, you know, being pulled over now. How are people feeling, you know, because I know personally myself, like I feel a certain way when I see a police car come past me. So there's just so much to this conversation, and we thank both of you for being available to have this conversation with us. Is there anything else you would like to add, you guys?
Jason needs to talk about TMS real quick because I think that's going to be one of the coolest things you guys are going to be hearing about.
Yeah, let's hear more about that, please.
All right, so TMS is a biological combatant for depression, anxiety, OCD, and other neuroses. Outside the United States, it's actually used for 11 different indications. Inside the United States, the ones I just listed. But basically, we know that the whole body works off of an electronic impulse, a synapse, if you will. And that synapse travels along a neuronal pathway, the superhighway inside your brain, specifically from the left dorsolateral prefrontal cortex, where all neuroses or mood disorders stem from, to whatever area of the brain that's going to release a neurotransmitter to counteract how we feel. So I use a couple of different horrible analogies. You know, if we go to prehistoric times, we got a surge of adrenaline to get away from big scary dinosaur, and then we got a surge of cortisol to kind of calm us down, make sure we don't feel all the bruises and bumps and scrapes, and make sure we don't have a heart attack. So that's analogy one, how the body naturally counteracts itself. The second part is that if you picture the proverbial children's game of telephone with two solo cups and a string, it's just poor communication. You have one kid saying, "Hey, you want to come spend the night tonight?" On the other end, the kid's kind of like, "Huh, what?" So what we've been able to do is enhance or optimize the natural communication that the body and the brain already has, so that when we have a feeling of depression, anxiety, the automatic counteracting part of it being the serotonin, the dopamine, can actually be released because the signal's gone through and the body's recognized it. So it creates that creates that homeostatic balance again, and the body can do what it's supposed to do. It's a minimally invasive treatment. There's no extra medications. The individuals are awake and cognizant during the treatment. And I say minimally invasive simply because some people do experience some sort of temporary headache just because of the sensation that's going through their body. But it's a fantastic treatment. I've seen between 750 and 800 treatments myself, and it's just had a wondrous impact on all individuals.
So use like some type of thing connected to the body that you're able to pick up on these things, or what is it that's used?
So the MRI magnet, or the magnet that's used, is an MRI based. So you're able to enhance. I mean, we've known that magnets could interfere, interrupt, or optimize electronic currents for a long time. So, we use repeaters on electric poles outside to make sure that the frequency or signal stays consistent and the power is delivered to every home. The same thing happens in your body when you create a subluxation, a break, or interrupt that continuity of flow. Using that magnet or that power to enhance, optimize, and reinvigorate that electronic synapse, you're able to show the body, reteach the body how it's supposed to work. So another horrible analogy, if you haven't ridden a bicycle in 15, 20 years like me, it might be comfortable to have training wheels for a little while until my body says, okay, I remember this, I know how to do that. So it's the same thing. Our course of treatment is 36 treatments. They're only 20 minutes a day, so it's a very, very small impact to somebody's daily routine to finally get the results that they're wanting without all the chemicals that we've introduced for a long time.
That's the coolest treatment ever. That is the coolest treatment ever.
I mean, it sounds cool, but I'll be honest with you, and this is coming from mental health. When you get to see somebody who has been so depressed for 5, 10, 20 plus years, and you see the physiological impacts, they're down, their marriage is failing, they don't want to go to work. Maybe they've picked up some secondary diagnosis because their body's trying to, subsidize what's going on. And then, 2, 3, 4 weeks later, they're a whole new person. They're wanting to be involved with their wife. They want to go to their high school reunion. They're, interacting with their children. They're being, excited about waking up and living life. It's a huge, huge thing to see.
So it sounds like it's sending some stimulation back into the brain to where you're able to have those feelings of pleasure and excitement and enjoyment.
You're introducing the stimulation so that the body can naturally have the ebb and flow. That if I have depression, okay, I'll naturally release the dopamine and serotonin so that it counteracts it and I don't feel the depression anymore.
Oh, that is pretty dope.
Yeah, right. I've been watching him do it for the past 7 months, and every single time I'm like, that might be the coolest thing I've seen in mental health ever. So it's really cool that he has that type of expertise to really break it down. I mean, and he's breaking it down in layman's terms, guys. I mean, the science is just incredible. But yeah, I appreciate you guys.
Yeah.
Thank you, everybody, for tuning in and joining us. This is Breaking the Stigma.
This is the Culture Therapy, yo.
Until next time, bye.
Later, guys.
Bye.